Hey, good morning, everyone. Welcome. My name is Dr. Aldo Maspons. Thanks for joining us. We are lucky enough today to be joined by Dr. Arturo Dominguez. He's a close friend of mine, graduate of Cathedral High School and Princeton University. From Princeton, he went on to UT Southwestern, where he received his MD degree, and then he did his internal medicine internship and residency at University of Washington in Seattle. Then came back to Dallas, Texas to do his dermatology residency. He's the director of inpatient dermatology at UT Southwestern, Parkland Hospital, County Hospital in Dallas, Texas. And thank you, Arturo, for joining us today. Dermatology extraordinaire.
Thanks.
A bit of a background, the new Parkland. So Arturo, you and I had talked a lot about just conditions for your dermatologist. And you work obviously in Parkland right behind you, and there's a lot of it's a big county system, so you see all kinds of conditions, from the cosmetic to the really sick. And we're talking a lot about how people of color, Latinos, other communities have a lot of skin conditions, and maybe the general public, or it's just tough to get information from mainstream media. And so we're going to talk about some of the conditions that you think are really important, just for like abuelitos and abuelitas to know about, and people in your family. So like, just talk to us about some of those things.
Yeah, Aldo, skin conditions are very prevalent in the Latino community. Like a lot of other medical conditions, Latinos and other people of skin of color have poorer outcomes when we look at things like skin cancer, when we look at diseases like psoriasis, which oftentimes are diseases that actually people sometimes get when internally we have other medical conditions that are going on. So, for example, psoriasis is something that sometimes people that are diabetic or that have overweight or high cholesterol also have. And so psoriasis may show up on the skin.
What's psoriasis? What is that? Like, if somebody who never had psoriasis and they're like listening, like, yo creo que mi abuelita tiene psoriasis. How would you explain it?
Yeah, so psoriasis is a skin condition that's due to inflammation inside of your body. And when people get psoriasis, they will oftentimes develop these very red and dry, scaly areas of skin, oftentimes on their elbows. They will oftentimes get it on their knees. They will often have scale in their scalp they think is dandruff, and in other parts of the body. And then that can spread to other parts. And so it can be a condition that people can feel disfigured by, but it can also be itchy, and patients can have sometimes other symptoms, even arthritis. So psoriasis is something that's very prevalent in the Latino community, Latino and Latino.
Do you think it's something like that people are just unaware of, and then they present a lot later? They go a lot later to see a dermatologist, or like how?
Yeah, I think also part of it's the lack of access, and a lot of it might also be due to the lack of low numbers of Latino and Latina dermatologists and physicians. So there's a lot of factors at play that go into it. And then I think also sometimes there's also a misunderstanding of what psoriasis is. I remember from one of my uncles is a doctor in Juarez, and when I would talk to him about different skin conditions, even among other medical professionals, sometimes people think, oh well, psoriasis, eso le da a la gente por los nervios, right? And they think that because you're stressed out or something that you might get psoriasis. And although emotional health and mental health can contribute to oftentimes skin diseases flaring and getting worse, those skin diseases are not caused by themselves because of stress or nervios. But certainly stress can make things worse, but by itself is not enough to cause the condition. So psoriasis is one of many other skin conditions that we see in our community.
If you're watching this, you're not a doctor, and you have somebody in your family or you yourself have some plaques, some dry plaques in the key areas, elbows, head, maybe looks like kind of a lot of dandruff, that's definitely spreading, that they should. It's tough in El Paso because I think the next available dermatology appointment is for like 6 months. But make it now so that way it can improve quality of life, right? Instead of them having to deal with these issues that are not due to stress, they can worsen with stress, but not caused by stress. They can get checked out and start getting treated, not just because from a self-esteem, quality of life side, but also because there's other diseases that interplay with stress.
Definitely.
Like heart
I think they can see their primary doctor and make sure that their blood pressure is under control, that their cholesterol has been checked, that they've had what other workup that they need to check for some of these other diseases that sometimes go with psoriasis. And then even when psoriasis is mild enough, just like if people have a little bit of dryness on the elbows, maybe dandruff, oftentimes that can just be treated with topical medications that can be prescribed by their primary doctor. Now, diet is also important, not only because, good diet can lead to weight loss, but sometimes certain foods can help bring down inflammation. Low glycemic diets, so low glycemic, like low sugar diets, all of those have been shown to decrease inflammation inside the body, and weight loss, healthy diets can also help improve psoriasis.
And right now, so we're going through, obviously we're going through COVID and people are wearing masks, and so I see a lot, I'm a gastroenterologist, so I don't necessarily have to look at this a lot, but sometimes I see people with like acne kind of around their mask. Can you talk a little bit about people who have this kind of acne now?
Yeah, so we certainly have seen a rise and an increase in acne that some people are referring to as like maskne, due to irritation of the skin around the mouth. Sometimes it can be, there's different types of acne. Some people can get what we call rosacea or perioral dermatitis, and that's a type of acne. And then there's also kind of just like the teenage type of acne. But basically both types can be worsened with mask wearing. Now, of course, even though Texas is lifting their mask recommendations, everyone should still wear their mask in areas where people are likely not to be wearing masks. But there's a lot of things that people can do to avoid irritation from mask wearing. Number one is to make sure that you're using a mild skin cleanser, once, twice, maybe even 3 times a day. Preferably cleansers that don't have harsh products in them, like alcohol or other oily substances that can clog the pores. Also, using like a gentle moisturizer on the face, something that's water-based, can also help prevent irritation.
What about like makeup? Like I see like people, even though they're wearing masks, they wear a lot of makeup.
Yeah, no, so that's a good point. So you should also try not to wear makeup under the mask itself, because that can also really clog the pores as well. If you want to wear makeup, you should really try to make sure that you have something that's non-comedogenic, and that's basically meaning that it's not going to clog the pores. And then you want to be able to do other things like You know, you apply that moisturizer, but then also when you take the mask off, like when you're back home, like reapplying that moisturizer, that can also really help. Lastly, sometimes the masks can irritate certain areas of pressure and friction on your face, like over the bridge of your nose or kind of at the corner of your cheeks and kind of oftentimes on these bony areas. And sometimes people can also really get chapped lips, chapped nose. And so what you can do for these areas is to actually apply a little bit of Vaseline or petroleum jelly on those points of pressure that are going to get really irritated. So, you know, I said don't use something that is oily, but that's like for like all over the place. But like in those areas of contact, sometimes using a little bit of Vaseline or something that's a little bit more oily can prevent like pressure and friction areas, or pressure or friction injury to the skin.
So we're talking with Dr. Arturo Dominguez. He's a dermatologist. He's director of inpatient dermatology at one of the best medical centers in the world at UT Southwestern in Dallas, also my alma mater. We are streaming live from Maspons Pediatric Gastro, and this is brought to you by the beMeDoc mobile health app that helps you stay connected, stay healthy. And Dr. Dominguez talked a little bit about psoriasis. He explained a little bit about what the plaques look like and the treatments and the risks involved in not getting seen. And then we also talked about masks and how it's developing. People are developing a lot more acne because of masks. And then he talked about some techniques that people can use to prevent acne and also to prevent some of the injury we get. I think we're all going to be chatos by the time this COVID ends. We're all going to be like jacked in our face. 10 years ago or so, I was looking at my face like, oh, look, I have some pimples. And it must be because I'm super young and I'm getting younger. And actually, you told me that I had rosacea, which was not awesome. But I didn't even know. And I'm a physician, and I had always thought about rosacea with noses who are a little bit thicker and larger. Can you talk a little bit about kind of how to distinguish the differences between acne and rosacea, and then what people should look for rosacea and treatments and etc.?
Yeah, sure. So acne rosacea is a specific type of acne that is characterized by a number of things. So people that have rosacea generally get more like red bumps, as well as sometimes red bumps that turn into kind of pus bumps. And normally the people will get those lesions in certain parts of the face, like usually kind of the forehead, maybe the cheeks, around the mouth, around the nose. And that's one type of rosacea. There's another type of rosacea that we call it's a complicated word, but it's erythrotelangiectatic. And what that means is that the face gets red, and then you have like flushing. And oftentimes people will complain of flushing or getting like very red, especially like after exercise or during stress, or maybe even sometimes certain foods, like, eating, comida picante, or even sometimes like alcohol, like all those things kind of cause the face to flush. And after the flushing is when sometimes people will develop some of these red bumps in these areas, like the next day. Rosacea can also be worsened by the sun exposure, because if the skin gets hot, or even through like UV exposure outside, that can make the face flush and sometimes make some of these bumps come out.
What do you think about sunblock? Like, even now it's still cold. Should people be wearing sunscreen now, even though it's not summertime?
Yeah. So this is another topic. Sun protection is very important in terms of preventing rosacea. if you have skin that's prone to rosacea, using a sunscreen that's at least SPF 30 or higher, or that even better is a physical blocker, like a mineral-based physical blocker, something that contains zinc oxide or titanium dioxide. These are a lot better for people that have rosacea-prone skin. Now, pivoting over to sun protection. So sun protection is something that's very very important for numerous reasons. Number one is for prevention of photoaging. And what we in dermatology mean by photoaging is the changes that we see in the skin due to chronic sun exposure. And some of those changes are, number one, wrinkles, number two, dark spots, sunspots that appear in the face, skin thinning, and then also some of the little spider veins and things like that I talked about. So sun protection is very important. And oftentimes we think that, you know, as Latinos and Latinas, just because we have darker skin, that we're not prone to photoaging. People forget, you know, Latinos, Latinas, we come in all shapes and sizes and all skin tones, you know, like there's some of us that are like white, blonde, blue eyes. And then there's a lot of other that we're just darker. And so people have different skin types. So you can't all group us all into like one particular group. And so people's skin is going to be more prone to burning, to photoaging. But skin cancer is the next, you know, reason why it's important to use a sunscreen on a daily basis, especially if you're someone that has lighter skin, and especially if you are in an occupation that works outside, or if you participate a lot in outdoor activities. Now, you know, with El Paso being the Sun City, we've always had the luxury of, you know, having the most sunny days in the U.S. But people need to remember that even when it's not sunny, if you're outside, like in the middle of the day and it's a cloudy day, those UV rays from the sun are still coming through the clouds, and you can still get a sunburn, and then also get photo damage on a sunny day. So it's important to protect yourself from the sun whenever you're going to be outside. So this is basically how we should go outside, like this. Yeah, you should see the pictures of a lot of like my dermatologist friends, like when they're at the beach and stuff. You know, they have like a huge wide-brimmed hat that's like basically hanging down this low, and then like they look like beekeepers. Yeah, beekeepers, are like those old swimsuits from like the 1930s. You know, like all the way down like that. But that's what a lot of dermatologists are doing to really protect their skin when they're outside. So, I mean, there's other things that you can do. You know, definitely like wearing a wide-brimmed hat. You really want to apply that sunscreen like 15 minutes before you're outside. You also want to try to avoid the sun, really kind of when it's at its peak, you know, between noon to 4 p.m., noon to 5 p.m., seek shade when you can, and so forth. Oh, sorry, man. We talked about you're talking about like kind of sun exposure and like people who work outside. What about like occupational eczema? Like I do a lot of like I try to keep everything kind of clean, and it's, you know, everyone right now is getting all crazy with, well, not necessarily crazy with keeping their hands, you know, sanitized, getting. But my hands are breaking up. I'm getting a lot of eczema on my hands. What do you say about that kind of stuff? Like people who are constantly hand washing and have breakdown of their skin. What could we do for that? Yeah, so people forget that that water and a lot of these soaps are basically irritants. You know, the repeated washing and drying and washing and drying of the hands and really any part of your skin is going to be irritating. And so for a lot of medical practitioners like yourself and people that are, you know, in occupations like in the restaurant industry or other things where they're frequently washing their hands, they're going to be prone to develop dryness and irritation and cracking. And so what we generally recommend is to use a moisturizer after washing your hands. And any moisturizer is better than nothing. But in general, things that are a little bit more greasy and oily, even something like Vaseline works really well. Now, if using Vaseline, you don't like that greasy look, maybe stepping down and using something like a cream in your hands, like a fragrance-free product, can be really useful. Now, if that by itself does not treat the problem, or if you're still breaking through it, it's probably important to see a doctor at that point because you may have like a dermatitis or inflammation or eczema that maybe needs to be treated with stronger topical steroids. But you can do a lot. You can do a lot to prevent these breakouts from happening just by following, maintaining good habits. They sell these like little jars of Vaseline or that you can kind of carry around in your purse, you can carry around in your pocket to moisturize your hands after washing.
We're talking with Dr. Arturo Dominguez. He's the director of inpatient dermatology at UT Southwestern, Parkland, UC Parkland County Hospital behind him. I think it's probably one of the largest county hospitals in the country. And we're streaming live from Maspons Pediatric Gastro, and we're brought to you by beNeXT. Stay connected, stay healthy. We talked a lot about just conditions in the Latino community, skin conditions that people should be aware of, like when you're getting together with your family, socially distant, or talking to them on the phone. We talked about mask knee, so acne when you have your mask, psoriasis, the eczema, and rosacea as well. One thing, because I deal a lot with kids, newborns, I have a lot of moms that come in and bring their kids, and they have a lot of this darker spots on their face, known as baño. Can you talk a little bit about what baño is, what it's known in English, because I forget what the term is in English, and then just what is it? Is it something that's more prevalent in Latinas and people of darker skin colors? And what can they do to lessen it, or is that something they have for the rest of their life? What do you think?
Yeah, so baño is what we in dermatology call melasma, or that's the formal diagnostic condition, melasma. Now, melasma is basically darkening of the skin that happens due to the darker pigments that the body produces, kind of going down a deeper level in the skin. And melasma can happen due to a number of different conditions. The most common is like in pregnancy. When people get melasma in pregnancy, we call this cloasma. So that's the most common. And that happens mainly due to a change of hormones that happen during pregnancy. But then there's other things that can also play a role, like, again, the sun. The sun is a big driver in people with melasma or baño. Then like other hormonal changes that can sometimes happen, like for example, in menopause, sometimes certain medical conditions like thyroid disorders, diabetes, things that can kind of upset that hormonal balance can result in people developing melasma.
Should they? So if you're not, so if you're a female, is this like a female thing, or do males get this too? Is it just a female?
No, men can get melasma too, and it's
So
actually I have I don't know if you can really see, but I have a little bit of melasma here, like on the upper cheek. That's like very faint.
You just look beautiful to me, man. I don't know. So
facial moisturizer.
It's moisturizer, sunblock. It's staying out of the sun. So if somebody has, so like, if I see somebody, or you're with your family, they have what looks like baño on their face, should they go see somebody, a physician, to say, like, I have this, like, can you check me for thyroid problems or heart problems,
yeah, like, I think at a minimum, like, I wouldn't run out and necessarily get checked just because you have it, because in general it's not an emergency. But in terms of like doing a workup, maybe checking checking your thyroid, and then maybe getting screened for something like diabetes, because sometimes there's other medical conditions that can kind of look like baño or like melasma. That is actually from diabetes. So there's something that's called acanthosis nigricans.
Yeah.
And that's
can you get that on the face?
Yeah, so you can get it on the face too. It used to be a lot rarer, but in people that are obese, especially in like severe obesity, you can get acanthosis nigricans on the face.
So acanthosis nigricans, for people watching, are not medical. It's just kind of like this velvety, darkening skin. And so the velveting is
in the armpits, in the neck, behind the neck.
Yeah. So I'll get a lot of my patients who I see for fatty liver disease. The moms will come in and say, like, no, pues es que este niño no se daña bien. But it's just this thick velvety skin, and at least in my world, for pediatric liver disease, it's screening for fatty liver disease is a common thing. But Dr. Dominguez is telling us that you can get acanthosis nigricans on the face, which, that's awesome, because I just learned something new. I'd never seen it on the face before.
And actually, like, traditionally, the teaching that acanthosis nigricans on the face used to be thought to possibly be like cancer associated. Now, sometimes people can develop certain skin conditions and skin changes that can be a sign of an underlying cancer. And so traditionally, acanthosis nigricans on the face was thought to be more cancer related. But I think as we've been seeing, the obesity epidemic that exists in this country, now it's not that uncommon to see acanthosis nigricans on the face. But anyway, we were talking about melasma, and so with melasma, it's something that is treatable, but there's a lot of things that people can do to try to reduce the risk for developing it, but also to try to improve and get rid of some of that darkening that they've developed. Number one is sun protection. So a lot of the things that I mentioned in terms of photo aging also apply to taking care of your skin for melasma. So making sure that you're using a daily sunscreen, again, SPF over 30, maybe also a physical blocker, something that contains zinc oxide or titanium dioxide. Oftentimes, those sunscreens are sold under like the label for sensitive skin.
But those are pretty white though, right? Like the zinc. Like if you have zinc in there, it's going to be like the surfing thing, where you have the
but now there's a bunch of different companies that make some of these products where they call them micronized zinc oxide and titanium. So basically, like the size of the particles of zinc oxide are smaller, and so they're not as noticeable. And then additionally, for people that have darker skin, they actually sell sunscreens that have a little bit of tint in them.
Oh, nice. Like which kinds? What would you recommend? Is there some brands that you know?
So if you don't mind me mentioning...
No, man. We're not academics, man. We're good.
So one of my favorite products is actually ELTA, E-L-T-A. It's just a line of different sunscreens, and they make one that has tint in it. I think that Elta UV Daily is one that I actually like myself. Actually, I have a bottle here. I can probably show you if you give me a second.
And just for the people watching, Dr. Dominguez does not get paid by Elta. He's just what he uses. He's not endorsing Elta at all. Maspons Pediatric Gastro, Dr. Aldo Maspons does not endorse Elta.
Yeah,
we're
so
just talking about products here.
So this is
like you're invisible.
Yeah, you can't probably see it from that far, but yeah, this is Elta UV Daily, and actually, you know, this one is actually like the tinted product. I don't know if you can. It's probably not coming across well, but I don't know if you see kind of this little brown smudge on there.
I just see some magic stuff happening.
That doesn't come through as well there, but yeah, Elta UV Daily. I think it's a good product because it has both moisturizer, the UV Daily lines. They have both moisturizers and sunscreens in them, and then they make this tinted version as well. So yeah, so sun protection is important, and then other things like wearing a wide-brimmed hat, staying out of the sun. And so I always tell my patients, you know, if you're not going to be sun protecting and you have melasma, whatever I prescribe to you is less likely to work. So, you know, I might, things that we use for people that have severe melasma include like a topical retinoid, which are products like Retin-A or tretinoin that we also use for acne. These work somewhat for melasma. And then they're oftentimes used in combination with other bleaching agents, with things like hydroquinone, and even a little bit of a topical steroid mixed in. And oftentimes the combination of those three products can really help decrease the darkening. But if you're not doing the sun protection, any sort of like gain that you make from using these prescribed creams, you're likely to lose from, you know, just a day or two of being out in the sun. So sun protection.
These topics, sorry, Dr. Dominguez, sorry, Arturo. These things with like retinoids, Retin-A, those are only at nighttime, right? Like when there's like decreased sun exposure, or like.
Oh yeah. Yeah. So generally, Retin-A is when we prescribe it for acne and for melasma and other things. We like patients to use them at night because they can be a little bit irritating during the day, especially if they're going to be out in the sun. They can make you a little bit more sun sensitive and more prone to burn. So you want to be doing the sunscreen during the day, and then maybe one of these other products at night. For people that have severe melasma, there's some new research that one of my colleagues and mentors, Amit Pandya, who's now in the San Francisco area, he's done some.
Oh, that's awesome.
Yeah. He's done some work with some groups out of Southeast Asia, like in Indonesia, where also melasma is more prevalent. So again, melasma is something that's more prevalent in people that have darker skin, Latinos, South Asians, Southeast Asians, Africans. That's melasma just happens to be more common in these populations. So he's done some work showing that there's some oral medications that people use for bleeding disorders, that because of the way that the medication works, the mechanism, it actually inhibits pigment formation.
So like which medicine would that be?
Well,
okay. That's fine. You don't have to. No, I'm not trying to put you on the spot. That's fine.
I don't want people running out and.
But it's not something that's like over the counter, right? It's not like something like it's not like something that's like over the counter that you can like just buy. It's something that has to be prescribed.
No. But I mean, you know, like with people sometimes buying stuff off-label and
yeah. No, we're not condoning any of that. Going off and buying.
Don't go buy this and buy.
Yeah. Don't say the name, because people are gonna go into Juarez buying stuff and bleeding all over the place and then blaming. So I wanted to. There's a couple of comments that I just wanted to address.
Yeah.
That we're getting from Facebook. So Dr. Indu Pathik is watching. Hi Indu, thanks for tuning in to Maspons Live here. So she wants to know about hands drying and cracking with free gift washing. If there's any moisturizer that you recommend. I think you had mentioned a little bit about Vaseline. Was there any other?
I think Vaseline is always the cheapest. Aquaphor is another brand that is like Vaseline. I think it's a little bit less thick than it. I also like something that's called CeraVe, the CeraVe ointment. Actually, I have a jar of that here. There
you go. Magic. There's Parkland in the background. Beautiful campus.
So this is here's CeraVe.
Oh yeah.
CeraVe ointment, and it's kind of a little greasy.
So but it's what would be the difference? Like I always have this thing where like those things are expensive. Right? Those products are pretty expensive.
Yeah. That's why I always mention Vaseline, because Vaseline
is it a Vaseline based product? They just add a little bit extra to it to just kind of raise the price.
Yeah, somewhat. Like, so for example, this CeraVe stuff. One of the ingredients in here is ceramide, and ceramides are these fatty molecules or fatty proteins that our skin naturally has. And in people that, for example, like have eczema, they think that the body just produces less ceramides and other normal components of the fatty, greasy layer of the skin. And that's why people are more prone to break out. And so, yeah, some of these products, they add ceramides in here. Whether it's more effective or not is kind of unclear. Aquaphor also has a little bit more, the water content is a little bit higher in Aquaphor. Now, sometimes some of these moisturizers can have preservatives in there that can sometimes cause irritation.
What about Luis Navarro wants to know about coconut oil? What would you say about coconut oil?
I think something like coconut oil can work okay for some people. I think like using it on the body is probably fine. I definitely wouldn't apply it to the face because it's too oily. Would be comedogenic, again, possibly forming blackheads and whiteheads. Now, you really want to make sure that if you're going to be doing something natural like that, again, that it doesn't have like any added preservatives or added fragrances, because people can actually sometimes develop skin allergies to some of these added fragrances and other ingredients that are sometimes added to these creams. And chronic exposure to a lot of these additives and fragrances over time can cause skin allergies to appear. So your body can react sometimes to some of these preservatives. Your body can react in the same way that it reacts to like being exposed to poison ivy or something like that. So
we're here with Arturo Dominguez, MD. He's a dermatologist, director of inpatient dermatology at UT Southwestern. We go way back. We're both graduates of Cathedral High School. He unfortunately went to St. Joe's. I fortunately for myself went to St. Pius. Obviously St. Pius is always better than St. Joe's. We talked a lot about different skin conditions in the Latino community. We talked about eczema, we talked about acne, about psoriasis, about recently talking about rosacea, and then paño or melasma, and then just different products. You did not give a formal endorsement to any particular product. And we're going to kind of wrap up. I want to be sensitive to your time, Arturo, and thanks a lot for joining us this Saturday morning. I want to say if you have any like dichos that you want to talk about. Like last week I talked about my abuelita would say que no te vayas a sentar en la calle caliente, un pavimento caliente porque te salen hemorroides. which I think I don't know why it makes me laugh so much.
Yeah,
I can just imagine somebody sitting on a hot pavement and then all of a sudden just hemorrhoids coming out from people. But, is there any dichos at all that your grandparents would say or your parents or anything that you hear about that you had mentioned a little bit about like stress and baño? It doesn't have to be like medical.
No, yeah. Like, I mean, one of the things that my grandmother would always tell me would be like not to like que no hagas caras porque así te vas a quedar, you know, like you know, or something like that. But you know, like in some ways she was kind of right in that you know, like I mean, a lot of the wrinkles that we have in our face.
That's right, dude. That's right. Yeah.
Are dynamic wrinkles, you know, from like smiling and like frowning and like, you know, like that's why people get Botox to like, you know, so like the wrinkles you get there when you're frowning, these are like some of the things that people get like paralyzed. So, you know,
my mom when she laughs,
was right.
She laughs like this. And she'll say like, no, me río pero me arrugo. So yeah, that's awesome. That's
because
that's
cool. Te vas a quedar así, pero ya cuando esté ruco. But and then there's like, you know, then there's other like, you know, cuentos de abuelita and stuff like that aren't necessarily true. Like I think one of the more common things that I hear is, you know, when people get hives or urticaria, salpullido. You know, that some patients call, you know, they tell me, no, doctor, me salió salpullido porque comí puerco el otro día. Y,
yes.
You know, so things like that. But, you know, probably when people get hives, usually the most common cause for hives is unknown. But hives can happen like following an infection or sometimes following a medication. But most of the time, we really don't know what caused the hives to come out.
I'm seeing though, you know, just talking about the puerco thing, that I see a lot of kids with food allergies, and like I think the list for, you know, I've been in practice since 2012 as a gastroenterologist, and the list of things that people are allergic to it's just like growing and growing. And before, like I see a lot of people allergic to like proteins like beef or chicken and that kind of stuff. And so, you know, I just thought about that because you said about the puerco thing.
Yeah, well, but that was what I was going to say about puerco is that, you know, I bet that like that cuento de abuelita comes from, you know, like puerco traditionally has been seen as sort of like a, you know, like a dirtier meat or like more likely to have parasites and things like that. And actually, sometimes parasites can actually be a cause of like chronic hives or chronic urticaria in some people. So again, you know, abuelita's dicho is kind of right, that there is some truth to that to some degree. But yeah, the whole hives and food allergies and things like that, it's a little bit controversial, I think, in terms of you know, the link with certain skin conditions and hives and stuff like that. Most of the time we don't find the cause, but there are obviously people that, you know, do have some food allergies, you know, shellfish and certain nuts and other things like that. There's also been, go ahead.
No, go ahead. I'm sorry.
No, I was going to say also, like out here in Dallas, there's a particular type of tick, like I think it's the Lone Star tick.
The Lone Star.
I might be wrong on the type of tick. I might be wrong about the type of tick, but there's people that actually develop meat allergies following tick bites. Yeah. And it's due to like the saliva of the tick has a protein in it that once you get exposed to it, it's the same type of protein that's in certain meats. And so these people that all of a sudden start breaking out in hives or even develop what we call angioedema or like swelling following exposure, or like once they eat meat, and it's almost like an acquired meat allergy that they get after a tick bite.
So I'm gonna I want to thank everybody for your comments. We're Shauna Goldman's on right now. Dr. Shauna Goldman. She's tuning in. Dr. Goldman, one of the great families of El Paso. Dr. Shauna Goldman, pediatric dermatologist, trained at UT Southwestern all the way through. Super awesome dermatologist who just moved back to El Paso. Thanks for coming back home, Shauna. It's really awesome of you, and thanks for tuning in. Last thing, I want to be a little bit selfish. Yeah. I mean, yes, absolutely.
She can talk about pediatric skin issues.
Yes, and I think it's actually a good I was going to ask you if you could maybe do a quick comment. I'll ask Shauna to come in to talk to you a little bit more about details. But can you, from a pediatric gastroenterology standpoint, from Maspons Pediatric Gastro, can you talk just super briefly about just G-tube care? Because there's a lot of my patients are watching now. They have G-tubes, or their kids have G-tubes. What would be like 3 things that you would say, just like to the ideal best way to take care of the skin surrounding G-tube, the gastrostomy tube?
Yeah, so like when I mentioned earlier about water being an irritant, moisture is probably going to be the main driver for a lot of these irritations and kind of the periostomal skin. But
the skin around the G-tube.
Yeah, but not only necessarily just moisture, but sometimes, if there's food contents that seep out, or if there's gastric contents or other, fluids from the bowel that come up, all of that can be really irritating to the skin. And so one of the most important things is moisture control. And that can be done through a number of ways. Again, with a lot of gentle skin care. So when you take the ostomy down, I think one of the most important things is you clean the area, but it's really important to let that area dry out before you apply the appliance on there, because if you apply that appliance and the skin is still wet, then that's going to trap that moisture, and that moisture is going to be very irritating to the skin.
So what would you say about gauzes? Because I have a lot of my parents who put a lot of gauze. And some put like really thick layers of gauze, which for me makes it a little bit tough because it puts a lot of pressure inside the stomach, and so it can create a lot of ulcers inside the stomach. But what would you say just for skin management, specifically regarding gauze and just kind of those like fabrics that go between the skin and the G-tube?
Yeah, so I don't know. I think putting the gauze directly on the skin might end up being irritating and counterproductive, because it's going to soak up some of that moisture, and then it's going to kind of trap that moisture. If you are going to do gauze, again, you don't want to make sure that it's too much. That's going to end up putting like a lot of pressure and cause almost like a pressure injury.
Yeah, that's right.
It would probably be a good idea that on the skin itself, you want to use like a bland moisturizer. Again, something like Vaseline, something that doesn't have any preservatives or alcohol or anything like that on there. Another thing that might work really well is to use like a zinc oxide containing product, which, zinc oxide is something that I mentioned earlier with these sunscreens. But zinc oxide is also kind of the main ingredient in a lot of things like diaper paste.
Desitin.
And Desitin. And so Desitin is something that's really, or the zinc oxide really sticks to the skin and it's kind of hard to take off, but it's like a wonderful skin protectant. And so, that's the reason why we use it as a diaper cream, because it's basically a diaper rash is from moisture, from trapped moisture, and friction, and heat. And so in a lot of ways, like the skin around the ostomy, you have kind of the same microenvironment as you basically have like in a diaper rash. You have moisture, you have occlusion, you have heat, you have friction. And so a lot of the same strategies kind of work in that area too. And oftentimes, the other thing that I mention is oftentimes we you know, whenever like non-dermatologists see like a rash in an area of what we call a flexural area, or like in the skin fold, you know, like between the butt cheeks, or like in the groin area, or again, like, you know, like under the ostomy, and it's red and irritated, people love to kind of call it, oh, well, this patient has yeast, or this patient has, you know,
everything's yeast.
Everything's yeast. So not all red skin in like these areas is yeast. And I would go further that and say, like, most of the time it's not yeast. Again, it's just like moisture irritation and so forth. And if there is yeast, you can usually, if you get the moisture under control, the yeast will go away. And so I actually don't use a lot of nystatin and other things like that. I think just, you know, with the barrier protection, and if there's a little bit of like skin irritation, like with dryness or weeping, or even like a little bit of blistering, using a low potency topical steroid like destinide or hydrocortisone 2.5%, a lot of that can help really calm down that inflammation once the irritation has happened.
Arturo, man, thanks so much for joining me on a Saturday morning, man. I know you got a lot of things to do, and we had a great conversation about healthy skin in Latino communities. You're born and raised in El Paso. This is kind of generally it's like a Latino topic. We're streaming live from Maspons Pediatric Gastro, and this is brought to you by beNeXT. Stay connected, stay healthy. We're trying to do this on a regular basis every Saturday morning. If there's topics that you, as the people watching, we're streaming live from Facebook, on Twitch, on Clubhouse, and Twitter, and I think we'll get on IG probably next week. We're trying to make this regular thing. If there's things people want to talk about, you know, I'm open to suggestions. I'm sort of like a DJ where I'm not necessarily taking requests, but I'll hear you out to see what you guys say. Arturo, thanks so much again for joining us. Dr. Dominguez, you're super awesome, man, and thanks for all the work you do. Hopefully, we can bring you back home permanently, so you can, you know, help out your hometown and keep growing. Thanks a lot, man. Thanks, and
Thank you.
all the best to you guys.
All right, take care.
Bye-bye.